So there are different cells and the bones which are responsible for the, which are having, showing the effect for the enlargement. So I just wanted to introduce these cells: osteoprogenitor cells, which give rise to osteoblast, osteocyte, and osteoclast. So osteoblast are bone forming cells, and osteoclast are for bone breakdown. So this is the process of bone formation. It starts with the development of cartilage, and this cartilage then grow, and then there is a development of primary ossification center in the center of this, and then the deposition of those calcium salt starts increasing the size, as well as those cells are also increasing in the number. Deposition is occurring so that the length of the bone increases, and this is the site where the cells of bones are residing. Now, cartilage and bone growth. Increased deposition of protein by the chondrocytic and osteogenic cells that cause bone growth. At the same time, it increases the production of these cells, and a specific effect of converting chondrocytes into osteogenic cells, thus causing deposition of new bone. So this way, long bones grow in length at the epiphyseal cartilage. This growth first causes deposition of new cartilage, followed by its conversion into new bone, thus lengthening of the shaft and pushing the epiphysis further and further apart. So this is stimulated strongly by growth hormone, which shows its effect on osteoblast. And this way, under the effect of growth hormone, bones can continue to become thicker throughout the life, and basically they are membranous bones. And apart from that, there are jaw bones and skull bones, which are also showing the effect, like forward protrusion occur if the growth hormone is increased more in amount, and bony protrusion over the eyes. This we'll see in the gigantism of different type. So this is the pattern of the release of the growth hormone throughout the day. In the morning, when you get up, the concentration of growth hormone is less, while it increases when you do activity during the afternoon, and in the evening it decreases, while at around 8 p.m. it again increases, and when you go to sleep at the midnight it again increases, and when you are about to wake up in the morning, the concentration of growth hormone decreases. Regulation of growth hormone secretion. So after adolescence, secretion decreases slowly with aging, and it is pulsatile, which increases during the first 2 hours of deep sleep. Normal concentration of plasma growth hormone in the plasma of an adult is 1.6 to 3 nanogram per ml, while child and adolescent have 6 nanogram per ml, while prolonged starvation can cause release of 50 nanogram per ml. So there are different conditions for the release of the growth hormones. So acute hypoglycemia is more potent stimulation than decreased protein, and at the same time, chronic protein depletion is more potent stimulation than decreased glucose. So the different pattern of the regulation of growth hormone is there. So accordingly, there are different conditions. Protein deficiency, which is kwashiorkor, can increase the concentration of growth hormone. And at the same time, when you give carbohydrate only, this will not have any effect on the growth hormone decrease. And then when the children is given protein treatment for 3 days, the decrease in growth hormone occur. And if it is continuing, then the decrease in growth hormone occurs. So that way, it shows that protein is required for the growth. Now, the factor that stimulate or inhibit secretion of growth hormone, there are different factors which can stimulate growth hormone secretion, like decreased blood glucose, decreased blood free fatty acid, starvation or fasting, protein deficiency, trauma, stress, excitement, exercise, testosterone, estrogen, deep sleep, stage 2 and stage 4, growth hormone releasing hormone. So all these factors can stimulate the release of growth factor, while at the same time, growth hormone can be inhibited by the increased blood glucose, increased blood free fatty acid, aging, obesity, growth hormone, inhibitory hormone, growth hormone, if you are giving exogenously, that can decrease the concentration of growth hormone release, and somatomerin, insulin-like growth factors, and they can also give negative feedback for the release of the growth hormone. Role of hypothalamus in secretion of growth hormone, which is via the growth hormone releasing hormone, which is secreted from the ventromedial nucleus, and this causes the release of growth hormone by sensing the change in the glucose concentration. So if it is hyperglycemic, it will give the signal of satiety, and if it is hypoglycemic, it will give the signal of hunger. And this shows different effect, short-term effect, which causes the release of the calcium ion, and that calcium ion causes the fusion of growth hormone secretory cycle with the cell membrane, and this growth hormone is released into the blood. And at the same time, long-term effect is to increase transcription in the nucleus by the genes to stimulate the synthesis of new growth hormone. In the next lecture, we'll study about the abnormalities of growth hormone secretion, like gigantism and dwarfism, different kind of like hypersecretion and hyposecretion of growth hormone or other effect along with that, like growth factors. Bye bye. एक तो wait.